I am Dr. R. Ajay Kumar, Senior Consultant Cardiologist, Cosmopolitan Hospital, Thiruvananthapuram, Kerala. Today I am talking about the latest update in hypertension. As per WHO, nearly 63% of total deaths in India are due to non-communicable diseases, of which 27% are attributed to cardiovascular disease, which affects 45% people in the 40 to 69 age group. Raised blood pressure is among the most important risk factors for cardiovascular disease. Moreover, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care through primary care, and poor follow up. In India, the prevalence has also gone up over 30 years, the last 30 years, to 38% in men and 32% in women, from 29% and 28% respectively 30 years back. This is WHO data. Despite that, nearly half of the people, or 51% of the men and 41% of women with hypertension, were unaware of about the condition. Additionally, over 62% of the men and more than 53% of men living with hypertension did not get treatment. Medication was used to control blood pressure in fewer than 1 in 5 men and 1 in 4 women with hypertension worldwide. This was published in Lancet in the present year, 2021, by WHO. The International Society of Hypertension, ISH, has released the ISH 2020 Global Hypertension Practice Guidelines. The inclusion of optimal and essential treatment paradigms attempts to address the issue that in resource poor settings. Optimal care refers to evidence-based standard of care, and whereas essential standards refer to minimum standards of care to allow specification of essential standards of care for low resource settings. The AHA-ACC has released a scientific statement in 2021 offering new guidance for management of stage 1 hypertension among patients with low cardiovascular risk. Among low risk adults with stage 1 hypertension, that is a blood pressure of systolic blood pressure of 130 to 139 or diastolic of 80 to 89, management starts with non-pharmacologic therapy. If blood pressure remains uncontrolled at 3 to 6 months, consider starting pharmacologic therapy. Acute respiratory distress syndrome, ARDS, is a potentially fatal condition involving lung damage, and experts often associate with severe COVID 19. A recent study which appears in the Journal of American College of Cardiology reports that metoprolol can reduce lung inflammation and improve respiratory function in people with COVID 19 induced ARDS. This has been published in the Journal of American College of Cardiology in September 2021. Lowering systolic blood pressure targets down to the 110 to less than 130 millimeter mercury range substantially reduce cardiovascular adverse events in the STEP randomized trial, affirming the sprint findings for an older Chinese population. Among some 8,500 patients aged 60 to 80 in China, the intensive target trimmed 26% of the composite cardiovascular risk. Findings from now a second major trial supporting a lower target could unite the guidelines, which even among US professional societies range from thresholds of 130 to 150 millimeter mercury. This is published in New England Journal of Medicine in 2021. With regard to prognostic value of ambulatory blood pressure monitoring and nighttime blood pressure, the 2018 European guidelines on the management of arterial hypertension recommend that the diagnosis of hypertension should not only be dependent on office blood pressure measurements but also on out of office measurements such as ABPM or home blood pressure monitoring, that is HPPM. 24-hour and nighttime BP measurements were associated with greater risk of mortality, and a composite of cardiovascular outcome. Thus, they may be considered as the most relevant measurements for estimating cardiovascular risk. For every 20 bar 10 millimeter mercury increment of BP measured at night, the risk of mortality increased by 23% and the risk of cardiovascular events by almost 36%. Most patients with hypertension require lifelong medical therapy to achieve optimal BP control. The 2018 European guidelines equally recommend 5 classes of antihypertensive drugs. Considering high non-adherence treatment, the importance of combination treatment is particularly highlighted to improve adherence to therapy and BP control. Therefore, the 2018 European guidelines recommend, especially in the context of lower BP targets, to start antihypertensive therapy with an initial dual fixed dose combination of AC inhibitors or ARB with the calcium channel blockers or diuretics. Since early July 2018, products containing valsartan have been recalled worldwide. The reason is the detection of a known carcinogen, namely N-nitrosodimethylamine, or shortly it is called NDMA, which can be found in candesartan, irbesartan, losartan, olmesartan, and valsartan. NDMA has been classified by the WHO, International Agency for Research on Cancer, to be carcinogenic in humans. If 1 lakh patients would have received NDMA contaminated valsartan from Zhengjian Huhuai manufacturing site where the highest levels of contaminants were found every day for 6 years in the highest dose, it could result in 22 additional liver cancers over the lifetime of these patients. The presence of NDMA in these drugs could lead to 8 additional cancer cases in 1 lakh patients if they had taken the highest daily dose over 4 years. Valsartan recall accompanied by a significant increase in the rate of emergency department visits of more than 6%. The Hygia study represents the largest study that tested nighttime antihypertensive treatment. In this trial, chronotherapy was associated with a significant reduction in endpoints, including death. The Hygia chronotherapy trial tested whether nighttime therapy in comparison to usual upon awakening hypertension therapy exerts a favorable cardiovascular risk reduction. The largest study included a total of 19,084 hypertensive patients. During an average follow-up of 6.3 years, 1,752 patients experienced the primary cardiovascular outcome. An ambulatory BP measurement was performed for 48 hours to collect data on how BP differed during sleep. The RR reduction for cardiovascular events was significantly improved for nighttime treatment when compared with the awakening treatment. So these are the primary points which I would like to highlight in the latest update on hypertension. Thank you very much.